this is Ligeia Ricciardi at the Digital Health Live studio at CES 2019. I'm here with Amy Foley, who is the Vice President of Product Innovation and Delivery at J&J. Welcome, Amy.
Thanks for having me. I appreciate it.
So tell me a little bit about your presentation here at CES.
So every year that we're here, it's so great to see the types of topics that are here, and I was really excited that today we were able to talk about preventative care, but really focus on individuals' well-being and their sense of mission and purpose, and how we can really manage that care from the beginning of time to the end of time and really make it relevant for folks. And it's great in a place like this at the Digital Health Summit at CES 2019 to be able to take in all of this technology and think about how to apply it.
So give me a couple of real-life examples that J&J is working on how you guys contribute to a consumer's wellness and overall health.
Sure, so there's a number of things that we do, right, from an innovation perspective, but one of the most wonderful things about J&J is that we're not focused on innovation for the sake of innovation or technology for the sake of technology. We're focused on those as enablers to really solve big healthcare problems. And so we're doing a lot in the areas of 3D printing and robotics to improve surgery. But what we really talked about upstairs today is about our Health Partners solution, which is a trio of connected health tools that we use to help patients currently in bariatric surgery, hip and knee surgery, be adherent to their care paths, but most importantly, that they understand what they need to do to really drive the behavior change, sustain it over time, all of what's necessary for them to be successful and have better health outcomes. And so what we found and what we talked about is that when people have an improved sense of well-being and they understand their mission and purpose in life, they're infinitely more successful from a health outcome perspective and from sustained engagement over time.
So it sounds like your suite of products really helps people from prior to the surgery, maybe during the process, and also that long follow-up process of getting reacclimated to their lives and becoming healthy and maybe even changing behaviors to prevent new issues and better manage what's going on.
Absolutely. I mean, when you think about sort of orthopedic surgery, you think about it very much as a point in time, but there's a lot of lifestyle aspects around that are important. From weight management to exercise to fitness, and obviously in bariatric surgery, lots of things that are very important there too. And so those lifestyle components that are really with you for the end of time, those are the things that are really important.
Excellent. Well, this is really exciting. And are you seeing any major change in terms of trends and what you've seen personally, if you've been representing J&J over a number of years here at CES?
Sure. I mean, I think what's really interesting is just looking at the show floor and looking at how many of these things are focused on the fundamentals that we all understand. And one of my colleagues on the panel talked about eating right and exercising and getting enough sleep. And those are really fundamental, but those are also things that we really aren't doing, right, as a society for any number of reasons. And so there's so much now focused and shifting to really being embedded with the average individual's ability to live every day instead of putting the burden on the individual, because we know that doesn't work, right? So it's really nice to see that, and it's really nice to see the emphasis in digital health become more and more every year.
Excellent. Thank you so much, Amy.
Thank you.
This is Ligeia Ricciardi with Carium here at the Digital Health Live studio, sponsored by Living in Digital Times here at CES 2019. Thanks.